Okay, testing. That's good. Recording there, recording there. Okay. Okay, we'll get started in about 8 or 9 minutes. Good morning. Good morning. Good morning. Good morning. Good morning. Okay. Testing. It's good. I don't know why my printer's not printing. I think the storm yesterday may have taken it out.
Were you without the power yesterday?
Mhm. Yeah. See if I can print it from here. All right, well, I guess it'll print from there. I have no idea why. Technology is not my friend, but the review video will be in black and white today. No clue. Did everybody get the emails I sent out? You did not get the emails, yes, on Monday night? There were 2 emails. Okay. Okay. So these email, I do not understand why that's black and white. That is weird. The 2 emails, one of them was a link to the page where all the review videos are going to be. So you're able to actually go back and watch the whole class 1 if you want, or what we're doing today. So, and that'll be up for a month after you graduate. So after that, I take them down because I'm getting ready to start a new class. Or it's actually it's only 2 weeks. Sorry, you guys are 2 weeks. So they'll be up for 2 weeks after graduation. So you're able to go back and rewatch them. Okay. And that's helpful for review because in 3 weeks, what we went over yesterday is going to feel like ancient history. So being able to go back and review it is helpful, especially when you can put me on like double speed to review. That's helpful as well. All right. So does anybody have any questions about what we went over on Monday? Any questions about Monday? Okay. How do we know what to do with each patient? Okay. So we follow the care plan, the whole care plan, and so that means we can't add anything to it. We can't take anything from it. We can't change it in any way. We only have 2 doors. We either follow that care plan exactly as written or we tell the nurse. Okay, good. You guys understand your role? About 40% of the test questions on the written test is going to address that in some way. That's how important that is. Because we can't have CNAs out there making decisions unknowingly, and you'll do it without thinking. I mean, you really will. You'll like start solving problems without even really meaning to solve problems, and that's what puts patients at risk. So even like questions that are addressing safety, one of the answer choices will be about your role. So it comes up on the test over and over and over again. And that's why I'm really, really wanting you to understand this at a fundamental level. We can build on learning how to do this stuff along the way, as long as you understand that we follow the care plan exactly, or we tell the nurse. It's that simple. Okay. So every skill is going to start with the opening. Every opening starts with a knock. And that's so that we're protecting the patient's privacy. That helps them feel secure. It alerts them somebody's entering their safe space. Knocking is very important. We're going to address them by name. So for the test, everybody is Mr. or Mrs. Jones. When you're playing the patient, you will be Mr. or Mrs. Jones. We just use one name, makes it super simple. But then you have to introduce yourself. What do you have to tell them about you? Name and title. Don't forget the title part. Then you're there to tell them what you're doing. Insert name of skill here, right? So tell them what you're there to do. And then you have to get something from them. What do you have to get? Permission. Once you get permission, then close the curtain. Don't go in and automatically close that curtain, because what that tells the patient is, I really don't care whether you consent or not. Right? So the order of the opening is really very important. Once you close that curtain though, that curtain, is that clean or dirty? So what do you want to do after you touch the curtain? Wash your hands. That way we're starting the skill with clean hands. Now we can go get our clean supplies. Good. The end of every skill is the same. We call it the closing. There's lots of C's in the closing. The first four, we really don't care what order they're done in. Like the opening is a specific order, yes. Closing, not so much, except for the last ones. So what are 4 things that you have to do to end the skill, and we don't care what order that's in? Okay, so comfortable. Clean environment, call light. Yeah, and one more. Curtain. So comfort, curtain, call light, clean. Comfort, curtain, call light, clean. If you can it kind of, you know, flows. Comfort, curtain, call light, clean. So if you can kind of remember that, it'll remind you of the majority of the closing. Comfort, curtain, call light, clean. Now, one of the things that I do when I'm working in a clinical setting, and you'll hear me do this in here, you'll hear me on the videos. It's not graded, but it is a good idea. And that is to ask the patient, do you need anything else while I'm here? This, if you learn how to do this right, this will save you tons of time in a clinical setting. Because let me explain to you what happens, okay? So we got a patient, and if you remember on Monday, we found out that that patient is grumpy, irritable, thinks they're dying, sleep deprived, right? Worry wart. So they're laying in bed with nothing much to do. They might have the TV, but you know, that's only going to go so far. They can see you running your tail feathers off. They see that. They hear it. They hear the call lights. They know you are super busy. They know it. So when you go in there and you do a skill, whatever skill it is that you're there to do, and you're in a rush to get out, they're not going to stop you. But they have all this time on their hands. So we go in and we do range of motion on this patient, which is some exercises, no big deal. And we're in a hurry. We do our closing really quick. Thank you, Miss Jones. Is there, you know, here's your call light. Your environment's clean. Open the curtain. I'm going to wash my hands and go because I got other things to do. You're in that rush. They're not going to stop and say, while you're here, can I get a cup of water? But they're going to lay there with nothing to do. And now that cup of water is on their brain. And they've got nothing to distract them. So how important do you think that cup of water is going to become? So they're going to try really hard not to bother you. But after about 5 minutes of their brain going, I really want water now, they're going to hit that call light. And they're going to say, I'm so sorry to bother you, but I really need a cup of water. And you're going to go, fine. And you get them a cup of water and you hand it to them because you were busy doing something else. And this call light, and call lights are supposed to be for emergencies. You're interrupting me for water, right? So you get a little bit of an attitude. And they're really cold, but do you think they're going to ask you while you're in there for a blanket? Because they can see you're busy, irritated, and they have nothing to think about now except being cold. So 10 minutes from now, they're going to hit the call light, go, I'm really sorry to bother you, but I need a blanket. And you're fine. I'll go get you a blanket. And you give them a blanket and okay, are you good now? Yes, I'm good. I'm good. Thank you very much. I know you're busy. I'm sorry. And you're going to leave. And that water's going to kick in. And what are they going to have to do? Yeah, go to the bathroom. And they're going to try to hold it and wait because they can see you being super busy out there, but they have nothing else to think about. So what's going to happen? That's right. Can you see how 14 of these, because you don't have one patient, do you? It can ruin your day. It can mess up all of your organization. It can totally wreck your time management. This is a problem. So at the end of every skill, if you want to learn how to really streamline your actions, at the end of every skill, you need to slow down. I know you're in a hurry to end that skill. I get it. But you need to slow down, look at your patient, and actually ask them, is there anything else I can get for you while I'm here? Not hurried. Is there anything else you need? Right? You want to slow down and ask them, is there anything else I can get for you while I'm here? Are you comfortable? This is the time they have you already there. If they want water, oh, that's a 2-second thing. Here's a cup of water. If they want a blanket, that's a 2-second thing. Here's a blanket. You've already washed your hands. I mean, it's you're there. You're theirs at this time, right? Where all those other call lights, when they hit the call light, every time you come in the room, you have to wash your hands. So it's a huge time waste. If you slow down, look at your patient and let them feel seen, and ask them and truly mean it, is there anything else that you need while I'm here? Because I'm going to go take care of some other patients now, and I won't be back for about an hour. Is there anything I can do for you while I'm here? If you get good at that, your call lights will go way down. Way down. Now you've got good time management because you're not constantly being interrupted by trivial things that are going to get under your skin. I was just in there. Why didn't he ask me for water while I was in there? Well, probably because you were rushing and he didn't feel comfortable asking you for water. Slow down. If you do, it'll actually help you speed up. I know it's kind of paradoxical, but it works. It really works. So when you hear me do these skills, you're actually going to hear me say, is there anything else I can get for you while I'm here? Are you comfortable? That's their opportunity to let me know, hey, yeah, I need some water, some ice chips, a blanket, really got to pee. Whatever it is they need, I can take care of while I'm there. But if I do it rushed, they're not going to speak up. My grandmother did this. My grandmother lived with my mom, and she was on hospice, so she had hospice aides come in, and of course my mom's taking care of all the cooking and things like that. The aides are helping her with all of her personal stuff. And the way that my grandma's little apartment was situated, because it was like an apartment on my mom's house, her recliner stared at her bed, right? The way that the TV was over here, the bed was over here. My grandmother, little backstory on her, she was a very persnickety individual. Like, I learned how to do hospital corners on a bed at 2, because when you got out of bed, you made it before you walked away, and it had to be picture perfect. So we've got this type of mentality, picture perfect, with nothing to do, staring at a bed that a hospice aide made. Now, the hospice aide is there to make sure the sheets are clean, relatively made. This is not good enough for my grandmother, right? This is not meeting her emotional need for order and chaos. So she would sit there in the recliner staring at this bed with nothing else to do. So about 15 minutes after the hospice aide left, my grandmother would start yelling for my mother to come remake the bed. Was it necessary? Absolutely not. That bed did not need to be remade, but she could not move forward with her day because it was right there and she had nothing to distract herself with. So I introduced her to solitaire on the computer. And that helped, because now she's got something to do, right? Oh, she drove my mom nuts. Oh my gosh. So happy hour became a thing. Grandma got wine at 5 o'clock every afternoon. Happy hour became a thing. I had to have sanity in that house. Oh my gosh. Sometimes we have to realize that patients they need emotional support as well as physical. Okay. Does that make sense? All right. So today, let me go back. I'm sorry. So we have the 4 C's. So comfort, curtain, call light, clean, right? We did all those. What comes after that? What do we have to do after we've made sure the patient is comfortable, opened the curtain, gave them their call light, made sure the environment's nice and clean? What do we want to do? Not quite yet. Charting is close, but not quite yet. What do we have to? Yeah, clean your hands. So the other C, the hidden C in the clothes, right? It's all C's, right? The hidden C or cooties. Cooties. You now have patient cooties all over you. You got to get rid of those cooties. So we're going to go clean our hands. After we've washed our hands, then we can chart. But if you chart for the test, we have to wash our hands again. Yep. I just ordered new banners and that's on the new banner. I know it's not on that one, but new step. All right. So any questions on what we learned on Monday? So we just reviewed all of Monday in 10 minutes. Today, I want to get into, we're going to learn mouth care. And I know I do apologize. I have to leave early. I know we're leaving at 10:30, but I want to get into mouth care today. Now, the reason that mouth care is the very first actual skill that we learn is it's one you're already familiar with. Most of you have brushed your teeth sometime this week. Okay. It's something we learn when we're very little. It's something that we feel pretty good about. We can do it without thinking. It's a routine task. It's no different to brush somebody else's teeth, right? Same process. Wet the toothbrush, put some toothpaste on it, scrub it up, rinse, spit, dry. I mean, the process is not any different. What makes it different is we're doing it on another person. And that person happens to be laying down in bed. Now, that's what makes it different. But the mouth care, you already know these steps. There's nothing new here, right? So that's why I start with it, because it is a task you already know. We're just going to adapt that task to this patient's needs. They're laying down in bed. That's not safe. We talked about that on Monday. We're going to get them sitting up. Get them sitting up however you need to. Maybe they can sit on the side of the bed. Oh, that's awesome, because then they can lean forward, less stuff on them, right? More natural brushing position. So if you can get them sitting on the bed, that's great. If not, we can put the head of the bed up. If you're in a home care situation and the bed doesn't go up and down, you may need to get them sitting up against the headboard. Whatever you need to do to get them in an upright position. There's no one size fits all here, right? Good. So for the test, we're just going to put the head of the bed up. We'll make that easy, but let's think about that for a second. If we're going to put the head of the bed up, we have to touch that bed controller. Who else touches the bed controller? Everybody. So is that bed controller clean? No. Now that's a problem, because we're going to put our hands in somebody's mouth. And yeah, we're going to wear gloves. We'll talk about that in a minute. Okay. But we're still putting hands in somebody's mouth. If I were going to brush your teeth, do you want clean hands or dirty hands in your mouth? Absolutely. We want clean hands, don't we? And every patient out there is the same way. They want clean hands. So when do you think we should put the head of the bed up, before or after we wash our hands? Before. So this is going to be worked into your opening. Now, the problem is that you are so used to the opening now because you've heard it. Hi, Miss Jones. My name is Patty. I'm your CNA today. I'm here to do mouth care. Is that okay? I'm going to close your curtain and go wash my hands because it's routine now. There's steps. Now, in there, we now have to add a new thing. And that's putting up the head of the bed. And you'll probably forget. And that's okay. It's okay. I've got a solution for you. So if during the test you find yourself in that position where you've done your whole opening. Hi, Miss Jones. My name is Patty. I'm your CNA today. I need to brush your teeth. Is that okay? Awesome. I'm going to close your curtain and go wash my hands. I'll be right back. And you go to the sink and you scrub a dub. Oh, wait, how long do I have to rub for? At least 20 seconds. Does that include my nails? No. Okay. So I've gone over to the sink. I've washed my hands like I'm supposed to. And I come over here and I look at the patient and I go, oh, man, I forgot to put the head of the bed up. Now what do I do? Well, you could put the head of the bed up and wash your hands again. Sure. But man, that is a huge amount of time, right? So a better way is to use a barrier. A paper towel between your hand and the bed controller. Keeps your hand clean, takes care of the problem. You don't have to take the time to wash your hands again. Make sense? Okay, let's talk about the head of the bed for a second. These things are slow. They're slow on purpose. Because if this patient is dizzy, nauseous, has a variable heart rate, I mean, there's a million things, surgery, abdominal incision, whatever. We don't want them moving fast. So we can play checkers in the time it takes to get the head of the bed all the way up. We know this. Don't give up halfway through. Don't think, oh, that's good enough. It is not good enough. They needed to be in a full upright sitting position. So I'm going to press this button until it stops moving. Motor's still running, but it has stopped moving. Now, that's important. This is not like cartoons that you saw on Saturday morning. These beds don't clamshell shut. They don't eject people. They simply stop moving. So go until it stops moving. Good? How do we know what to do with each patient? The care plan will specify. Okay. So if I have a patient with hip replacement that can't go all the way up, my care plan is going to say HOB, which is head of bed. We'll get into medical abbreviations later. HOB to 45 degrees. Okay. So it's going to be specific. It's going to tell you, because I don't want you to guess. I don't want you to think. Right? Because if the care plan was very non-specific, it just said head of the bed, not all the way up. And you went too far and that hip dislocated because the cement had, and the muscles had not healed, the cement had not hardened, and you dislocated it, then, you know, the nurse is going to be upset. The patient's going to be upset. The doctor's going to be upset. And well, the care plan just said not sitting upright. I mean, what does that mean? Right? So in order to avoid that poor communication, we're very specific. Good? Okay. Now, I'm not going to tell you that all of your nurses are good. So you may have a care plan that's not specific. You need it to be specific. So what would you do? Ask the nurse. Okay, it says not all the way up. What does that mean? Little up, halfway up. What does that mean? Need specifics. Okay. So think of a care plan like a recipe. Anybody in here ever cook? Like at all? Think of a care plan like a recipe. If the recipe says, put stuff in a bowl, mix it up, and put it in the oven, does that help you? No, you need to know what to put in the bowl, how much of that to put in the bowl, how long do I mix it, put it in the oven in what kind of a pan, how, a big pan, long pan, loaf pan? What am I, a saucepan? I mean, what am I doing here? What temperature should the oven be and how long should it cook? You need those details for whatever you're cooking to come out correctly, don't you? That is a care plan. A care plan is a recipe for caregiving on this patient. Now, if you've cooked it all, you'll know that no two recipes are exactly the same. So no two care plans are exactly the same. So if you think of a care plan as a recipe to take care of this patient, it starts to make sense. Does that make sense? Okay. So we've got this patient sitting up, but there's a problem here. Do you see this pillow? It's kind of pushing her head forward a little bit. This makes her esophagus, or the tube that goes from her mouth down to her tummy, and her trachea, which is the other tube that goes from the mouth and nose down to the lungs, right? They sit right on top of each other. It puts them out of alignment. So her head kind of pushing forward makes all of this kind of go like this. And that actually can lead to aspiration. This is not really safe. So when you put the head of the bed up, the best thing to do is either take the pillow out from behind the patient, or even better, have the patient sit forward just a little and put the pillow down behind their back. So Ms. Jones, can you lean forward for me just a little bit? And we're going to put the pillow down there. And now she's sitting up straight. Good. Not all people can tolerate this, especially if they've got a big incision in their tummy or they have big tummies. You may have to remove the pillow from the bed. Good. Questions? So I want to go back to putting the head of the bed up for a second, and we used a paper towel. That was good. But some of you are thinking, I know you are, well, why don't you just use gloves? Put gloves on. Okay, so who are those gloves really there to protect? The patient. That's right. But in healthcare, we tend to get that mixed up. We think, oh, there's all kinds of ooey gooeys in here. I don't want to be exposed to that. So I'm going to put gloves on so I don't get exposed to all those ooey gooeys. But here's the thing. I already have a good working immune system. Who doesn't? The patient. Remember, those gloves are there to protect the patient. Now, the real problem with wearing gloves routinely all the time without ever thinking about it is that we stop thinking about it. And that's a real problem. So I'm going to walk you through an activity to show you why wearing gloves routinely can actually be more detrimental than not wearing them at all. And it has nothing to do with healthcare. How many of you guys have ever had a sandwich made in front of you? We won't say the names of the places, right? But let's say that we are going to order a sandwich. So all of us, we're going to work together. We're going to order the sandwich, and I'm going to build it for you. Okay. So you come up to the counter. And of course, you don't want me touching your sandwich with bare hands. You don't know where my hands have been. So what do I put on? Gloves. You're happy with that. So I ask you, what kind of bread would you like? White. So I'm going to go over to the oven warmer, bread warmer thing. I'm going to open the door, grab a loaf of white bread, close the door, put the white bread on the counter, and I'm going to pick up the knife that's laying there and cut that bread and fold it over. Would you like mayonnaise on there? So I'm going to reach in. There's that, little knife spreader sticking out. So I'm going to reach in, grab some mayonnaise, spread it on the bread, put it. Would you like some mustard? So I'm going to pick up the mustard container and squirt it on the bread as well. What kind of meat would you like? Ham. So I open up the little refrigerator underneath and I look, oh, I'm out of ham. Hold on one second. So I close the refrigerator, go to the back, open the cooler, get the container that has the sliced meat, open the lid, grab some ham out, close the lid, come out, close the door, put the rest of the ham in the refrigerator, and take that one piece of ham and we're going to put it on the sandwich. Would you like any cheese? Swiss cheese. Oh, this sounds like a good sandwich, right? So I'm going to open the cooler, get the cheese out, close the cooler, put the cheese on there. Would you like this toasted? Oh, that sounds good, right? Ham and Swiss toasted. So I'm going to pick that up and put it on that little paddle thing, right? We're going to open the toaster door, put the sandwich in, close the door, turn the knob, and we're going to wait. Do, 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 do. It dings. We're going to open the door, take it out, put it back on the counter. How about some lettuce? So I'm going to reach my hand in and get the lettuce and sprinkle it on tomatoes. So I'm going to reach in the tomatoes and kind of squeeze them out a little bit and put them on. Pickles. Okay, we're going to do that with the pickles, squeeze that out. Olives. No, no olives. Onions, green peppers, anything else? Banana peppers. Banana peppers. So I'm going to reach in, grab some of those and sprinkle. Are we good? You want salt and pepper, oil, vinegar? No. Okay. So we're going to push that sandwich together. Pick up that knife, right? To kind of shove all the stuff inside. Fold that sandwich over, cut it with the knife, grab a paper, and we're going to wrap up that sandwich, pick up a bag and throw it in. Wrap up the other half of the sandwich, pick up the bag and throw it in, fold it over. We're going to go to the thing that prints out the little label, and we're going to type in what ham and Swiss on white, and we're going to put the label on the bag, and then we're going to hand it to you. So this sounds like a good sandwich. What's wrong? Okay, so did those gloves do what you thought they were doing? And yet you were very happy that your sandwich maker was wearing gloves because you didn't want them touching your sandwich. See, the problem with gloves is they give us this false sense of security, and we stop paying attention to what we touch. Now, we do this in healthcare all the time. By the way, that sandwich is perfectly fine to eat. Your immune system has to have a little bit of challenge now and then to stay in tip-top shape. So don't stop eating sandwiches, okay? It's perfectly okay. But I need you to be aware of this, because if it's happening in a sandwich shop down the street, it is definitely happening in your local healthcare center, because as CNAs and as healthcare workers, we go in, we put on a pair of gloves, and we do exactly what that sandwich person did. We touch everything without thinking about it. And that's how we cross-contaminate. Does that make sense? Kind of scary, huh? Yeah. Nurses will walk into a patient's room, empty the drainage bag, and then hand them a cup of water and not think twice. We've got to be better than that. We need to pay attention. So our rule here is the first thing your gloves should touch is the patient, not a bunch of other stuff. We got to keep our gloves clean for the patient. Remember, they're the ones at risk. Does that make sense? Okay. So kind of the default position for a lot of people is I'm just going to wear gloves for everything, you know, no matter what the skill is. I don't want to have to learn when I'm supposed to wear gloves, when I'm not. I'm just going to wear them for everything, make it easy. But the problem is that when we wear them for everything, just like the sandwich shop, we stop paying attention, and that's what puts us at risk. So that strategy doesn't work, and you can't use it on the test. If you try to wear gloves for a skill that doesn't require gloves, they're going to tell you you don't need gloves for that. And they're also going to, you'll get a deficiency in infection control because you don't understand when gloves are appropriate. Okay. Now that can really derail you. Remember, you're going to be nervous on the test, right? Can you imagine the evaluator telling you you don't need gloves for that? You'd be thinking, is this a trick? Oh my gosh, what do I do now? So that's why I'm trying to warn you. You've got to learn when gloves are appropriate, and it's counterintuitive because it's not based on the skill. So like if you look, let's go to mouth care real quick. Let's go to page 66. If you look at the bottom of page 66, you're going to see test information. So it's going to tell you how long somebody with your level of experience should take to do this skill. So you should be able to do this skill within 12 minutes. I don't know about you, but it's never taken me 12 minutes to brush my own teeth. I mean, 2 minutes is like, 2 minutes of scrubbing is kind of like what the dentists tell you to do. It doesn't take 12 minutes to do this. And we're not flossing, we're not water picking, we're not mouth washing, we're not doing anything but brushing teeth here. So they give you lots and lots and lots of time. It tells you who the person that you're going to do this on will be, and that's going to be another live student. So yes, you might find yourself a patient for the test getting your teeth brushed. Yep. Not comfortable. Nobody likes having it done. Your patient doesn't like having it done either. Trust me, if they can brush their own teeth, they will. They aren't going to want you in their mouth if they can do it themselves. So we only do skills for patients that they cannot do on their own. Make sense? Good. All right. It also tells you where the person's going to be in bed. And this one doesn't require charting, which is a good one to start out on. But if you notice, nothing in the bottom there tells you whether gloves are required or not. I'm giving you all this test information, but I'm not telling you whether gloves are required because it's not based on the skill. It's based on the person you're doing the skill on. So let me explain. Let's say that we're going, one of our skills is range of motion, hip, knee, and ankles. So we're going to go in and move a leg and do some exercises on it to help, reduce muscle atrophy, which is the shrinking of the muscle, reduce contractures, which is when the muscles kind of freeze in a certain position because they're not being used. So exercise is good. So we're assigned to go in and do some exercises on the patient's right leg. No big deal. Now, that patient may or may not require gloves, depending on what's going on with them. The skill doesn't require gloves. We're just moving a leg. But the patient may or may not require gloves. It really depends on what's going on with them. Do they have a communicable disease that we know about? Do they have body fluids that we are going to be exposed to? Do they have open skin that we are going to encounter? Am I going to go anywhere near bathing suit parts? Those are the things that I'm going to be looking at here. Does that make sense? So it's not based on the skill. I can't give you like a little glove icon and say for this skill, you'll always wear gloves because there's very few skills that applies to. It's always based on the patient. Good? Makes sense? So we have to have some rules to go by. We have to be able to figure out pretty quickly whether we need gloves or not for this patient. So there's 3 things that we're going to ask ourselves, 3 questions. The first question is, when I'm doing the skill, am I going to come into contact with anything ooey gooey that's not mine? Right? So it depends. Mouth care? Yeah, I am. I'm in their mouth. It's ooey gooey. It's not mine. I need some gloves. So I can stop there. Need gloves. I know I need gloves for this skill. But range of motion depends. Is the patient incontinent and not wearing any sort of briefs? Well, then I might come into contact with something ooey gooey. Right? Is the patient fully dressed, incontinent? Well, I'm not going to come into contact with ooey gooey. So we have to look at this based on the patient. Okay, so the first question is, am I going to touch anything ooey gooey when I do the skill? If the answer is no, move on. If the answer is yes, you need gloves. If the answer is maybe, not sure, you need gloves. Okay, so the only time that we can move on is if the answer is a firm no. So the second question, looking at the patient, I'm not going to touch anything ooey gooey. They're fully clothed. They're fully continent. I'm good. I'm going to move on to the next question. The second question is, am I going to touch any personal skin? So this would be anything normally covered by a bathing suit, breast area on females, genital area on both sexes. So normally covered with a bathing suit. If doing the skill, if I'm going to encounter any of that skin, I need some gloves on. But if not, let's move on. The third question is, am I going to touch any non-intact skin? So non-intact skin would be things like sores, wounds, rashes, incisions, anything that makes the skin not intact. So if the answer is no, I don't need gloves. I went through all three of my checklists. I don't need gloves. If the answer is yes, I need gloves. If the answer is maybe, I need gloves. So mouth care is pretty easy because we can stop at the first one, right? Am I going to touch anything ooey gooey doing this skill? Yes, because it's saliva. I need gloves. I can stop there. But other skills are a little bit more complex. You have to go to the second one. Personal skin? No. Okay, let's go to the third. Do they have any non-intact skin I'm going to be touching? No. Okay, I don't need gloves. So those are the three rules that we use to determine whether we need gloves or not. Ooey gooey, personal skin, non-intact skin. If the answer is no to all three, you can safely proceed without gloves because we are going to wash our hands before we touch the patient. And what are we going to do after we touch the patient? Wash our hands. But let me explain to you why gloves are not the magic suit of armor you think they are. And I'm going to prove it to you. How many of you guys have ever seen a birthday balloon kind of bopping up against the ceiling, right? You got a Publix or Dollar Tree, whatever, you have it filled with helium, bops up against the ceiling for a couple of days. What happens to those balloons after a couple of days, though? Yeah, they shrink, they deflate. Those balloons, I'm not talking about the silver ones, the mylar, the foil looking ones. I'm talking about the actual rubber balloons. Those are made out of the same material as gloves are. So we have to understand that the balloon itself, when it is inflated, okay, all man-made materials have holes. They're microscopic. You may not be able to see them, but they're there. So latex, which is what these balloons and gloves are made of, when it's in its inert state, when it's, you know, just kind of laying around, the holes are very small because it's, you know, kind of the weave is very close together. But as we inflate that balloon and that fabric stretches, what do you think happens to those holes? They open up, they get bigger. Those holes are what allows the helium to escape. That helium molecule actually works its way through the holes in the latex. So that should tell you right there that your gloves have holes. Now, helium molecules super small. I mean, you can't even see them. They're super small, right? So these holes are microscopic. Do you know what else is microscopic that you can't see? Yeah. And viruses are 100 times smaller than bacteria. So these viruses can absolutely get through those holes. Those gloves are not the magic suit of armor you think they are. They're not. They have done many studies about this. They've cultured a hand after it's been washed, right? They look to see how many pathogens are on that hand. They tell you to put gloves on, you go do some work, and then you take those gloves off and they culture that hand again. And every time there's pathogen transfer. So the gloves are just kind of getting rid of the majority, but stuff is still getting through. So what do you think you should do after you take gloves off? Wash your hands. And that is the step that is most missed because people have this false sense of security. They go in, they put gloves on, they take care of the patients, they take the gloves off, and they think those gloves kept them safe. And they don't wash their hands. Now, we tried all kinds of things to try to keep people from doing that, try to get people to wash their hands after they take gloves on. We take gloves off, sorry. We make the gloves smell funny so that, you know, your hands smell funny after gloves. We put this powder in there that's kind of like irritating to the skin to try to get you to wash your hands after you. We do all kinds of stuff to try to get you guys to the sink after you take gloves off, but you still won't go. Anybody ever shop at Walmart? You know, back when they had cashiers? You'd always see this little old lady cashier that would be checking people out and they'd have gloves on. They don't want to touch your ketchup. They don't know where it's been, right? So they scan all this stuff. They work for 4 hours. It's break time. Has anybody ever worn gloves? What does it make your hands do? Okay, so underneath this glove is warm, dark, moist. What grows there? Yeah, all the pathogens, absolutely. So 4 hours of sweating in these gloves, pathogen transfers. They're beep, 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 scanning all your stuff. And it's finally break time. So they take off their gloves and they sit down to eat their sandwich because they don't wash their hands because, hey, I wore gloves, didn't I? And they eat their tuna salad sandwich with a side of E. coli. Yep. Now, some of them will put some hand sanitizer on, right? So get a little hand sanitizer, rub it around, and that kills, it actually degrades the membrane of about 99.9% of pathogens. So that's a good deal, right? Okay, so how many of you guys are willing to ride a roller coaster when you know that on that roller coaster, sometime today, one of the people that's riding it is going to die? Could be you. You guys willing to ride that roller coaster? Yeah. Yeah, that's exactly what this is. So yeah, you're using hand sanitizer. You've got pathogens on you. You're killing most of them, but that 0.1 that remains, it could do you in. So when you wash your hands, where do the pathogens go? Yeah, they're no longer on me. When I use hand sanitizer, where do those pathogens go? Yeah, they don't pop, pop, pop into the atmosphere. So I'm walking around with dead E. coli on my hands, which is no more appetizing than live E. coli. I don't want to eat it. So if you're going to bring your hands anywhere up near your face, you probably ought to make sure that they're truly clean, not just hand sanitizer clean. Make sense? But here's the real problem with hand sanitizer. Bring him over to show you. This is my little hand sanitizer dispenser. So most of us, when we're going to use hand sanitizer, we get about, a little bit. Rub it around and we're good. In order for hand sanitizer to be effective, it has to have 20 seconds of prolonged contact with the pathogens. Wait a minute, we've heard that 20 seconds before somewhere, haven't we? Yeah, and you don't generally use enough hand sanitizer to keep your hands wet for 20 seconds. So when you're using hand sanitizer, you got to get quite a bit, right? So we don't use enough. So we want to keep this wet for at least 20 seconds. That's a long time. A long time for it to be effective. And remember, all we've done is kill them. We didn't remove them. Just wash your hands. Way easier, right? Now, hand sanitizer is a good option in a lot of settings because it does, I got a little too much that time. It does, they're still wet. It does actually break down the membranes of the pathogens. So it is, I mean, it's not a bad thing, right? It's not a bad thing, but it's kind of overused. And the real problem is if it's not used correctly, it can actually be used as a weapon against us. So let me explain to you how this works. So, you know how we have an immune system, right? Humans have an immune system, right? Anybody know how the immune system works? Like broad strokes, what happens? You know how your immune system works?
Well, basically, you have something foreign coming into the body, you have the little attackers, your immune system to kill it.
Okay. All right. And then if you ever get exposed to it again, your body knows how to fight it, right? Everybody familiar with that? Basically, let me give you a little bit deeper understanding into this without getting overly scientific. Okay. So let's say that we have an armed intruder that comes in this room. Okay. Head to toe, in ninja outfit, right? They got their weapons and they're here to do us harm. We know it. Well, we're going to try to figure out how to get rid of him. Right. So I'm going to tell all of you, oh my gosh, need your best ideas. Let's get this guy out of here. Right. So you don't have any weapons on you. So you try throwing that water bottle at him. It doesn't work. You don't have anything. So you do spitballs. That doesn't work. You try stabbing him with a pen. That didn't work. You bash him over the head with the phone. That's a pretty hefty phone. That didn't work. You start pummeling him with your fists, right? That still didn't work. So you pull out a knife and stab the guy to death, right? So congratulations, you killed the bad guy. Thank you very much. Now, what we figured out are things that did not work, right? So water bottle didn't work, spitballs didn't work, pen didn't work, phone didn't work, right? Fist didn't work. We know all these things that did not work. Well, I'm standing there. I'm not fighting that guy. I guess what I got you for, right? So I'm taking notes. So I know, okay, so water bottle, no, doesn't work. Spitballs, no, doesn't work. Pen, no, doesn't. So I'm taking notes. And then I find out, okay, well, the knife, the sharp stabby thing, that worked, right? So I write down, no. So I want you guys to all know, hey, if you see this guy again, let's go straight for the knife. Let's not waste all this other time, right? Let's go straight for the knife. So I send out a memo with a picture of the guy. Hey, you see anybody that looks like this, you use this, right? So we all have the memo. We're all on the lookout for this bad guy. But over time, you get a whole lot of memos because there's a whole lot of bad guys out there. So you end up with this filing cabinet full of memos. When a bad guy comes in, now you're cross-referencing, trying to find the right guy and the right, weapon and how this all works, right? That's how our immune system works. And if we're successful, if we can find the right memo and we can kill the guy, no infection. Good? Make sense? Do you know who else has that same immune system? Absolutely. Pathogens. Yep. Viruses and bacteria have that same system. And they actually use it against us. So while I'm standing here taking notes on how to defeat that bad guy, right? I'm taking all these notes. On their team, somebody else is taking notes. Hey, they tried a water bottle. If you dodge this way, you avoid it. Hey, they tried spitballs. If you duck down, you avoid it. Hey, they tried stabbing with a pen. If you wear this outfit, you'll avoid it. Hey, they're going to try to smack you over the head with that phone. If you wear a helmet, you can avoid that. Do you guys see how that works? So everything that we try against them, they are keeping a record of and then adapting to overcome it. Scary. So when we only use a little bit of hand sanitizer, not enough, we did not kill all of the pathogens. See, we really need to kill the one that's taking notes. Because if we don't kill that one, yeah, we might get successful and kill one, the main intruder. But if we don't kill the guy that took notes, he's going to pass it on to all of the other intruders. So the next one that comes in is ready for that knife. Do you see how that might be a problem for our immune system? Okay. So when we use hand sanitizer, we want to make sure that we're using it effectively. Same reason that doctors keep telling you take all of your antibiotics. It's the same thing. Because what we did is show them our entire arsenal. Here it is. This is how it works. Here's the owner's manual. And then we're surprised when they develop resistance against it. Because you got to kill the guy taking notes. And he's way back in the back. So you got to kill all these other things to get to him. But if you don't kill the guy taking notes, it's going to spread. Make sense? Take all of your antibiotics. Serious. Don't ever leave any of them for later. Take them all. Got to kill that guy. All right. Any questions on that? So if you're going to use a hand sanitizer, make sure you use enough. But hand washing is always preferred. If you've got access to a sink, use it. Because your hands are going to be wet for the same amount of time anyway. Just washing down the drain. Okay. Good. Okay. Do I have anybody in here allergic to latex? Nobody. Okay. So part of learning gloves is knowing how to take them off properly without cross-contaminating. So we're going to learn that now. These are extra large. I know they're going to be too big for you guys. That's okay. It gives us an opportunity to practice.
Do you have other options?
Yes, let me get you the green ones. They're not as easy to work with to remove. What's that? Oh.
You didn't wash your hands first.
That's right. You're welcome. Okay, go ahead and put your gloves on. Okay, so once you have your gloves on and you've touched your patient, you've done all the things you're going to do, all of the things, and you're ready to take your gloves off. How you take them off is actually the most important part of wearing gloves. I've spent a lot of time talking about, when to wear them, but taking them off is the most important step because we know that they're covered in pathogens. We know this. We don't want to accidentally cross-contaminate ourselves. So dirty glove can touch dirty glove. This is fine all day long. We cannot let dirty glove touch our skin, so do not go underneath. Now, a lot of people do this without even realizing it. They won't go underneath, but they'll put their thumb under. Be very, very careful about that. They're looking for this on the test. If a dirty glove touches skin, it's an infection control deficiency. So in order to take the glove off, you're going to take 2 fingers and pinch up here at the palm of your hand, not near the cuff. Don't go near that cuff. Pinch up, pull it off inside out, and ball it up in your hand. So you're holding onto that glove for dear life. You don't want it waving around. Now, skin can touch skin, that's fine, but you cannot touch that dirty glove. So don't do this. You've got to go underneath that cuff and pull it off so that one inside out glove is inside the other inside out glove. Now you can take these home and clean your bathroom with them. I don't care. Throw them away if you want. But taking your gloves off is a graded checkpoint all by itself. And it counts big. So you want to practice that. Okay, good.
You work with epoxy, you'll know how to do it.
Epoxy?
Yeah.
Yes. Yeah, I used to do resin, a lot of resin work. So yeah. In fact, I got a huge resin burn on my leg one time. Apparently I'm allergic. Crazy. So knowing how to take the gloves off correctly is a big part of wearing gloves. So let's review this really quick. We're going to wear gloves if we could possibly touch anything ooey gooey that's not ours, private skin or bathing suit skin or non-intact skin. The first thing the gloves should touch is the patient. Keep your gloves clean. Pay attention to what those gloves touch after they're contaminated, right? We don't want to touch the bed controller or the cup of water. What have your dirty gloves touched? And then make sure you're removing those gloves correctly without cross-contaminating. So everybody good with that? You just learned a whole new principle. Okay, good. All right. So the first skill that we're going to learn is mouth care. And if you look on page 66, at the top of the page, you can see care plan. Everybody see that care plan? This is the testing care plan. So if you test and you get mouth care, this is exactly what your care plan is going to say, what's at the top of the page. Below that are your supplies. And a lot of students get hung up on supplies. Do I really have to learn all those supplies? Aren't they going to give them to me on the test? No, they're not. You have to learn the supplies. Because if you're my CNA and I ask you, what's your name? Brianna. I ask you, Brianna, can you go brush her teeth for me? I'm not going to tell you, and you need to take a barrier, a cup of water, toothbrush, toothpaste, gloves, and a towel. I'm not going to give you the list of supplies you need. I'm just going to tell you, go brush your teeth. Right? So yes, you have to learn the supplies, but make them make sense to you guys. You're brushing teeth. I mean, what do you use to brush teeth? You know, make them make sense. But if we have supplies, we have to have a place to put those supplies. So we're going to use for the test an overbed table. That's this thing. For the test, it's a miracle. It's an absolute miracle. There will be nothing on this table. I've never seen an empty overbed table in a clinical setting in my life. Overbed tables are going to have food trays, extra cups of juice, water pitcher, water cup, comb, cell phone, chapstick, crossword puzzle book. I mean, this thing is like, you're going to have to carve out a space. But for the test, it will be an empty table. But can we consider this table clean? No. People eat on the table, so there's probably grape jelly from breakfast or brown gravy from last night's dinner. It's also the only space that the patient has to put a urinal. It's not clean. So we can't just come in, put mouth care stuff on this surface. It's not clean. We also don't want mouth care stuff on the surface. It's going to contaminate the surface as well. So we have to create a clean surface. So we're going to use a barrier. Now, a barrier can be anything. You can use a paper towel as a barrier. You can use a bath towel as a barrier. Anything that separates this surface from my supplies is a barrier, and I'll use it. But for the test, we're going to use a very specific kind of barrier. And that's this. This is called a Chucks. It is a little different than this. Okay, these two things do. Really? These two things do the same thing. They're both bed pads, incontinence pads. This one is washable and reusable. We usually call it a bed pad. This one is disposable. We chuck it after we're done with it. So we call it a Chucks. If you try to use its full name, disposable underpad, that's a lot of syllables. So we just call it a Chucks. Now we're going to use this as a barrier. Okay, so it's called a Chucks. That's what it is, but I'm actually going to use it as a barrier. So when I'm talking about barriers and I pick this up, it's a Chucks, but I'm using it as a barrier. So we want to put this on the table so that the waterproof side is down against the table. The absorbent side is facing up. That way, if I spill anything, it's not going to drip onto the table. And anything that's on the table isn't going to get onto my clean items. Good? Okay, but we have a lot of supplies to get. We need a towel. We need toothbrush, toothpaste, a cup of water, gloves. We got a lot of things to get. And we have to get this barrier too. Well, if I get all of that stuff and I'm trying to juggle that stuff and put this barrier down, I'm going to end up holding that stuff against my uniform. My uniform is not clean once I start work. It's leaned against the bed. It's brushed up against the curtain. It's pressed up against the sink. It is not clean. You cannot hold clean items against your uniform. So when we do this, when we use a barrier, so any skill that we have that has supplies, we need a barrier. That's the first thing we're going to start with. So we do our opening, knock, knock, knock. Hi, Ms. Jones. My name is Patty. I'm your CNA today. I'm here to brush your teeth. Is that okay? May put the head of your bed up, close the curtain, wash my hands. And now I'm going to go get a barrier. I'm not getting my supplies yet. I'm going to get a barrier, put the barrier down and unfold it and get it ready. Now I can get my supplies and have a place to put them without pressing them up against my uniform. Good.
And if you have other stuff on the table,
So for the test, won't be an issue. It'll be an empty table. It's a miracle. In a clinical setting, it really depends on what I'm dealing with, to be quite honest with you. If I've got enough space that I can just kind of carve out an area for myself, I'll put the barrier kind of over everything else, you know, so I'd have like this stuff here and I would just put the barrier over it. If it's something that I can easily move, I'll clean the table off. So if there's a urinal on there, urinal should never be on this table. This is where the patient eats, right? So if there's a urinal, that's the first thing that's going. I'm taking that thing. I turned that off. I'm taking that thing to the bathroom. Sorry. I'm taking that thing to the bathroom and dumping it and getting rid of it. If there's a food tray there, I'm taking that to the soiled utility room. So I'm going to try to clean the table off as best I can. But if it's the patient stuff that can't be easily moved, I'll just put the barrier kind of, I'll clear off this little space, put the barrier over everything else and use it that way. Okay. Good. Questions on barriers? Okay, so remember that our opening, right? Knock, knock, knock. Hi, Ms. Jones. My name is Patty. I'm your CNA today. I'm here to whatever. Is that okay? Close curtain, head of bed if I need to. And then I'm going to go wash my hands. When I wash my hand, I have to have clean hands to get clean supplies. That makes sense. But when I wash my hands, the first thing I'm going to get is the barrier. So the way we remember this is we always start with a barrier. Okay. Questions? You just learned a whole nother principle. 1, 2, 3, 4, 5 down. There's only 6 to go. Okay. It's only class 2. Any questions on that? Gets thrown away. Yep. Gets thrown away. And you can use anything as a barrier. You can grab a paper towel. You know, if you're just working with some small supplies, paper towel might work. You can grab a bath towel, pillowcase. I've used newspaper as a barrier in home care, right? Because you don't want to set your nursing bag down on patient environment. So there's, you know, you can pretty much use anything between whatever supplies you're using and whatever surface you're putting it on. And usually we'll throw that away. Now for the test, we're going to recycle them. In here, as long as they don't have ick on them, we're going to recycle them. But in a clinical setting, throw it away. Right? Any questions on that? No? Am I going too fast for anybody? All right. So I'm going to show you the video for mouth care. But I want to address this really quickly because this comes up a lot in my online thing. Right now in COVID world, this is not being tested. Mouth care, denture care, and feeding are not being actively tested because they require that the patient be unmasked. And as of right now, masks are still required during testing. Now, I expect that to change, and it probably will change before you get there because a lot of these mandates are being lifted now. But it always comes up. So I just wanted to let you know, right now, these 3 are not being tested, but that doesn't mean you shouldn't practice them or learn them. Remember that the test is 40 minutes out of your life. The patient that you take care of next week is probably going to want you to know how to brush somebody's teeth effectively. So remember that we're not practicing for the test, we're practicing for the patient. Does that make sense? But I do want to let you know that, yes, I'm aware they're not testing on them right now. All right, so if you look at the top of page 66, the care plan says a resident with natural teeth is lying in bed and needs mouth care. The resident is not able to provide their own mouth care. So a question inevitably shows up. What if they have dentures? We have a whole skill for that. Go ahead and turn the page to 68. You'll see that we have a different skill for denture care. We will learn this later in the program. I do not teach mouth care and denture care at the same time. The reason for that is my whole class, in case you haven't noticed, is predicated on forced repetition. So I went over the same thing over and over on Monday. And then what did we do today? We reviewed it. What do you think we're going to do next Monday? Review it. So by teaching mouth care and denture care on 2 separate days, when we get to denture care, I'm going to say, do you remember mouth care? Let's review it. Okay. Do you see why my students don't have any problems on the test? Super easy. Super easy. Because I'm in your brain now. You're actually going to hear me during the test in your brain. Yeah. I wormed my way in there, man. So let me tell you a cute story about this, and then I'll show you this video. So years and years and years ago, I had gone to, I needed a haircut. I was going to a conference and my stylist couldn't get to it. So I went into Walmart to the little haircutting place there. And I'm sitting, the stylist takes me in and I'm sitting in the chair and I'm not really paying attention. I'm actually thinking about the presentation I was going to be making, not paying attention. And so off, like behind me, like over here, there's another stylist and a client. And I'm like in La La Land. And I hear, ow. And the client says, oh my gosh, did you cut yourself? And the hairstylist says, yeah, let me go grab a Band-Aid, ooey gooey. That got my attention. Well, I'm the one that uses ooey gooey. And the client said, oh my gosh, you must have gone to Miss Patty's class. And the stylist said, oh my gosh, did you? So here's 2 people, right, that had taken my class years ago. One of them was working in medicine, was now a nurse. The other one remained a hairstylist, but worked part-time as a CNA on, you know, her off days, right? One statement, ooey gooey, united the 2 of them. And I'm sitting there listening to this, laughing. And my style, because now I'm laughing, my style's like, what's so funny? And I'm like, those are 2 of my students. And I was able to pick them out that quick. And of course, then they turn around, oh my gosh, what's that? So it was really kind of funny. I am in your head and you can't get rid of me now. You will actually hear what I say because I'm going to say it over and over and over and over, but it will also let you connect with other students that were in my class because I have a very unique way of presenting the information. So yeah, you'll find other Miss Patty students out there, easy. Now that's actually going to be helpful for you because most of the hiring managers in this community actually sat in the chairs that you're currently sitting in. Most of the RNs that hire here started right here in this classroom. And when you give them your resume and they see where you went, it's an endorsement. You're going to be able to use me as a professional reference as well at the end of class. I open up a lot of doors in this community. So stick with me to the end. We're going to get you through the test, but we'll also help you get employed. Okay, good. All right. So now we know what we're doing. Let me show you the video on how to do it. And the good news is my TV cart is being delivered tomorrow. Oh, that won't work until it's plugged in, will it? My blonde is showing.
Happens when you want to rush it.
Yeah, I know. I'm really dreading this doctor's appointment.
It's gonna be fine.
So how long did our book tell us we had to do this? 12 minutes. Do you see how long this video is? And this includes the whole intro and the credits. So you've got plenty of time. Don't stress out about time. We'll talk about time a little bit later in the program, but you've got plenty of time to do these skills. Do not rush. These videos are always available on my website. They're also on YouTube. Okay. Can you grab the lights, please? Thank you. All right. Any questions on that, on mouth care?
No, but do you have to say every step that you're doing?
Okay, so that's the next thing we're going to talk about. And I actually just did a lesson on this on my live question and answer session. So understand that these are training videos, right? I'm training you. So I'm telling you every step that I'm going to do because you are learning. And that's fair. You've also got step-by-step instructions in your book that tells you how to do it. You can actually take this book home, hand it to any live human that you have lying around. And not a dead one, they won't help you, but live one. And they can read these steps and you do them. And that is a way to practice where you're absolutely positive you're practicing right. And then after you've practiced it once or twice, don't have them read it to you, just have them read along and tell you if you missed anything. So you can actually do dress rehearsals for the test right at home. Okay. But the question is, do I have to say everything that you say? Well, I'm training. So of course I'm going to say a whole lot, but do you know who else doesn't know how I'm going to be doing the skills? The patient. So if I am brushing somebody's teeth, that means I have to go into their drawer to get their toothbrush and toothpaste. That drawer may have their wallet, may have their cell phone, may have their wedding rings. Do you think that they are comfortable with me going through their possessions if they don't know why? It'd be like me coming into your house and you invite me over for dinner, right? But that's like a living room, dining room thing. That doesn't give me permission into your room. And it certainly doesn't give me permission into your private areas, like your dresser, right? So if I'm going to open a drawer, I want to make sure that patient knows why I'm opening the drawer and what I'm planning to get out of it. Does that make sense? So should you? Yes, you should. Is it a graded checkpoint? No, it's not. There's no checkpoint that says said every step out loud, but there is a checkpoint under indirect care that grades on was the patient informed and comfortable. So that's the checkpoint that talking out loud is going to satisfy. Does that make sense? That's a great question. Great question. We have a lot of people in Florida, way more than I am comfortable with, that do nothing more than watch my videos. That's it. That's all they do. They watch my videos, never took a class, never got a book, never took a course. They watch my videos. They go into the test and parrot exactly what I say and do, and they pass. Now, how much further along are you going to be having me here teaching you? Right? Because my videos, they didn't go over barriers and gloves and all of that, right? That's all information you guys have now. All they did is go in and monkey see, monkey do. And they pass. Have you ever watched a movie so often you learn the lines? Right? You can do that. But that doesn't mean that you're really going to be an effective CNA. A lot of those people wash out within a month or two. They get into a job. They're like, oh, this is not what I thought it was going to be. I was, imagining Grey's Anatomy, Dr. McDreamy, where is he? This is not what I signed up for. So they wash out. We can't have more washouts. We need you to be successful. We are 166,000 CNA positions open. Doesn't do me any good to spend all of this time getting you guys ready for the test if you're going to wash out a month later. Those patients out there need you. So I have to make sure that you are well trained, not for the test. We'll get past that, but so that you can effectively care for those patients. Okay. That's my goal.
I noticed that you dispose the toothbrush.
For the test, you will dispose of the toothbrush. Yes, we don't want you rinsing it out and putting it back in the drawer because that person that you're doing it on is not going to be here tomorrow. We don't want cross-contamination. So yes, for the test, you will dispose of the toothbrush. In a clinical setting, we're going to use a toothbrush like we do at home. We'll just rinse it out and store it wherever they normally store it. That's another thing. 2 minutes here. That's another thing. Be careful about the supplies you choose to use for your patients. Anybody ever been a patient at a hospital? Anybody? Did you get a bill? Yeah, a bill. Yeah. If you ask for an itemized bill, they will give you every single thing that they, healthcare is not free. In fact, healthcare is horribly expensive. So that toothbrush that they issued you and you thought, oh, cool, this cheap 2-cent toothbrush shows up on your bill as a $7.50 line item. Now, I don't know about you, but I don't want a $7.50 toothbrush charge every single day that I'm there, right? One, that'll do me, thanks. And if possible, I don't want your toothbrush. I'm having my hubby bring mine from home, right? I don't want yours. $7.50, that's a whole lot of money for a toothbrush. So we have to be careful about the supplies that we are choosing for the patient. A lot of CNAs will throw the bedpan away every single time. They just throw it away. That's like a $38 charge. How many times you go to the bathroom a day? Every time. Can you imagine being charged $38 every time you had to go to the bathroom? And you don't know about it until 2 weeks later when you're home and get the bill, right? So clean them out. It's what we're there for. Don't throw them away because you don't wanna. A lot of things I don't wanna. Right? So we got to be careful about the supplies. Great question. Any others? Any others? Okay, today's replay will be up, but it probably won't be up on the website until tomorrow because I don't have time to process it today. So it probably won't be uploaded until tomorrow. Please remember before you go, please remember you have 2 chapters of homework over the weekend. You're going to read chapters 2 and 3. And you're going to take the test. You're going to take the test on page 133 and 134. This is one. Okay, when I call your name, how many guys did the homework? I forgot to do this. How many did the homework? Did you guys do the homework? Okay. Did you grade the test on page 132? Everybody grade it? Using the answer key in the back? Okay, if you didn't, that's fine. No big deal. When I call your name, if you can tell me how many you missed on chapter 1, I'll tell you what your score was. So page 132, if you graded it, tell me how many you missed. If you didn't grade it, just say pass and I'll get it from you next week. So Jashini? Okay, thank you. There were 5 points apiece, so that's an 85. Paulette? Very good. 95. Ty? That's okay. So just pass and I'll get it from you next week. Jordan? 2. Very good. 90. Brianna? Thank you. 95. Lauren? Okay, Ashanti? Thank you. 95. Freddie? Okay, Savannah? Thank you. Daniela? Thank you. Donald? Thank you. Tracy? Thank you. Brittany? Thank you. All right, guys. So chapters 2 and 3, you're going to read chapters 2. It's a little bit longer. Read chapters 2 and 3. 3 is horrible to try to slog through. Take breaks. Don't try to read it all at once. It's boring. Just it is. It's boring. Take breaks. Do the test on page 133, 134 and grade them. I'll get your scores when you come in on Monday. You can review the video on the website. Remember the 2 emails that I gave you. I've given you links to everything in there. And you also have the online course as well. So if you want to review anything that we went over, or you can work ahead, that's fine as well. A lot of the things you're going to see in the online course, I will go over again in class. Other than that, have some fun this weekend. It's a weekend. Have some fun. And I will see you guys on Monday. So do I. It's okay. Oh, yes. I'm sorry, guys. Hold on 1 second. Review sheet. Let me give you your review sheet. It won't be complete because we didn't go over everything, but Oh. Whoa. Okay, there you go. Man, when it printed everything. All of them. Yes, grab two, they're small. There you go.
Yeah.
Thank you.
One for me, one for Savannah.
There you go. Thank you. Thank you. I'm going to ask you to do me a favor. When we come in on Monday, I want you to remind me to tell you guys about practice time.
Okay.
I get on a roll and I forget. And it'll be like at the end of the program, you'll say, oh man, I wish I'd known that earlier.
Sorry.
Bye. Okay. We're gonna go here. We're gonna go here